Hello, my name is Alexandra Santos, and I'm an elementary teacher in the Huntsville area and a Master's of Teaching student at the University of Toronto. Thank you for joining me today to view my poster. The title of my study is Supporting Mental Health Literacy Education, Perspectives from Northern Rural Elementary Educators in Ontario. This is my acknowledgement statement. And now for background. Educators in schools are well positioned to help students learn about mental health, and they play a critical role in supporting student well-being. In 2019, the Ontario government enhanced the health and physical education curriculum for grades 1 to 8, implementing a more comprehensive approach on mental health that focused on mental health literacy, which is the knowledge about mental health disorders that is associated with their recognition, management, and prevention. Action to improve mental health literacy education in northern rural Ontario is essential to reducing health inequities and supporting the emotional, educational, and social well-being of students. Listening to the voices and perspectives of educators who are on the front lines of this work is an overdue and timely contribution to this vital area of mental health education research and practice. Research questions. My main research question was, what are the perspectives of educators working in northern rural communities regarding the new mental health literacy expectations in the 2019 Ontario Health and Physical Education curriculum? And my subsidiary questions focused on the outcomes, barriers, and supports needed related to teaching these new expectations. Conceptual framework. The data collected was explored through a conceptual framework that utilized Cooper Ryder's appreciative inquiry and Radayal's 2010 rural social space model. Methods. This research is based on a small-scale qualitative study that drew on semi-structured interviews with 3 northern rural elementary educators and that met the sampling criteria outlined on this slide and which were recruited using a purposive snowball sampling strategy. Transcript data was analyzed using thematic analysis to identify and evaluate patterns. Findings. 4 themes that emerged from this thematic analysis included student outcomes, barriers to curriculum implementation, available supports for, and supports needed for improving mental health literacy curriculum implementation. While northern rural teachers perceive that implementing the mental health literacy expectations positively impacts student mental health and mental health literacy, a lack of teacher knowledge of mental health literacy and limited access to mental health literacy training and northern rural relevant resources were identified as barriers to effectively implementing this curriculum. In response to identified barriers, educators employed available supports such as online resources and professional collaboration when available to aid implementation. Despite this, northern rural educators face several unique challenges and feel there is a need for increased supports, including professional collaborative learning opportunities with mental health professionals. Summary and conclusion. The new 2019 mental health literacy expectations in the Ontario Health and Physical Education curriculum were introduced to improve student mental health literacy and thus mental health. However, examining how northern rural Ontario teachers experience enacting this curriculum is critical to ensuring the curriculum's goals. This study demonstrates that teachers experience a need for increased mental health literacy resources, supports, and communities of practice in order to improve their implementation of the mental health literacy curriculum and thus support youth mental health education in northern rural Ontario. Thank you.